My name is David Rose. I am a surgeon here at Penn, Chester County Hospital. I work and see patients at Fernhill and in Valley Forge, and I practice breast surgery. When I was in college, I majored in chemistry with an interest in humanities, and as I met with career counseling, they said, why don't you give medical school a trial? When I got to medical school, gradually I focused in on where my interests were in terms of my long-term career. My interest in surgery really started when I was rather young. My mother was a kindergarten teacher, and we did a tremendous amount of crafting at night. We worked with latch hook rugs, we did pottery. So working with my hands and doing artistic things was always an interest. When I went to medical school, that attracted me to surgery, but more so what attracted me was surgery takes you with a patient from A through Z. What makes me a little different from other providers at this point is my gray hair. I have been in the practice of surgery for more than 40 years. And when I started, I was 100% a clinician focused on patient care. In my later years, I did a lot of administrative roles. I was chief of surgery in the past. I was the vice president of medical affairs for a period of time. Now that I am back in my second career, as I call it, the joy is I'm back where I started. I'm taking care of patients 100% of the time. I think at this point, the most important feature of patient care is to have a patient-centric approach. Our primary role is to educate the patient, their significant others and family so they can be involved in the decision process. And nowadays, with all the new technology and the new learning that we have, it's often multidisciplinary and can be quite confusing. So I think as an educator, that's the most important thing we do. One of the exciting things as being part of Penn Medicine is we're on the cutting edge here. We have the most up-to-date facilities, technology, and as part of that, we are in the process of developing a high-risk breast clinic in Valley Forge for appropriate screening. What we're realizing more and more is breast diseases and breast cancer is not the same in every patient, and it's not necessarily the same disease. There are patients who are at low risk, there are patients that are at high risk, and as the usual, the group that gets often ignored is the group that's at moderate risk. So we're in the process of putting together a clinic that'll look at the moderate and high risk. It used to be there were a few choices for treatment. It was very simple. Now the choices are really almost infinite. Each patient's care is individualized based on their specific disease and the features of their disease. And as we get more and more sophisticated, that becomes more complex. And one of the beauties of being part of this medical community is we have the opportunities to deal with all the complexities on the front end. I'm 100% of the time available to the patients. I'm available to you. I think that if there's ever an issue or a question, I want to be there to answer it, not only for the patients, but for each and every one of my provider colleagues. So the message I leave for all of you is never hesitate to call. I'm always attached to my cell phone, and every question is a good one.